In an increasingly interconnected world, travel has become an integral part of our lives. Whether it's for business or pleasure, exploring new destinations can be an exciting adventure. However, it's essential to prioritize your health and safety while traveling, which often involves getting the necessary vaccines. In this video, we will delve into the top 10 facts about travel vaccines in the United States, providing you with crucial information about their usage, dosage, administration, and potential side effects. The information provided in this article is for informational purposes only and should not replace professional medical advice. Consult a healthcare professional or travel health specialist for personalized recommendations based on your specific needs and travel plans. Number 10. Vaccines protect against infectious diseases. Now, let's face it, diseases like hepatitis A, typhoid, yellow fever, and meningitis sound like the villains in a B-grade sci-fi movie. But in reality, they're real troublemakers that can turn your dream vacation into a not-so-fun episode of Survivor, the Germ Edition. Nobody wants to spend their hard-earned getaway time feeling like a miserable mess, right? That's where travel vaccine swoops in to save the day. They're armed with special powers to shield you from the evil clutches of these diseases. It's like having a team of microscopic bodyguards working tirelessly to keep you healthy and kicking during your travels. Number 9. Consult a travel health specialist. Before embarking on your journey, it's vital to consult a travel health specialist or visit a travel clinic. These professionals have the expertise to guide you on the specific vaccines recommended for your destination. They will assess your medical history, travel plans, and any specific risk associated with the region you are visiting. Number 8. Timing is key. So here's the deal. Some vaccines work in stages. They need a little extra time to train your immune system, pump up those antibodies, and make sure you're armed and ready to take on any pesky pathogens that may try to ruin your vacation. It's like enrolling in a vaccine boot camp. You show up for your first dose thinking, alright, let's do this. But then you're told, hold your horses, my friend. You'll need a follow-up dose in a few weeks or months. Cue the dramatic sighs and eye rolls. But hey, look at the bright side. Planning ahead is always a good idea, especially when it comes to protecting yourself against infectious diseases. So mark your calendar, set those reminders, and give yourself a pat on the back for being a responsible traveler. Remember, timing is key. You don't want to be scrambling last minute, trying to squeeze in those extra shots while juggling your suitcase and frantically searching for your passport. Give yourself the gift of time and make sure those vaccines have ample opportunity to do their magic. Number 7. Routine vaccines. In addition to travel-specific vaccines, ensure that you are up to date with the routine vaccinations recommended by the Centers for Disease Control and Prevention, or CDC. These routine vaccines include measles, mumps, rubella, or MMR, diphtheria, tetanus, pertussis, or DTaP, polio, and influenza. Staying current with routine immunizations will provide an additional layer of protection against common diseases. Number 6. Vaccine dosage and administration. Most travel vaccines are administered through injections, but some can be administered orally. The dosage and frequency of vaccinations depend on various factors, including the type of vaccine, age, and individual health conditions. It is important to follow the recommended dosage schedule provided by your healthcare provider to ensure optimal protection. Number 5. Common travel vaccines. Some of the most common travel vaccines recommended for travelers include 1. Hepatitis A vaccine. This vaccine protects against hepatitis A viral infection that can cause liver damage. This vaccine is typically administered in 2 doses, with the second dose given 6 to 18 months after the initial dose. 2. Typhoid vaccine. This vaccine protects against typhoid fever, a bacterial infection transmitted through contaminated food and water. The vaccine can be given as an injection or orally, with booster doses required every few years depending on the type of vaccine. 3. Yellow fever vaccine. This vaccine protects against yellow fever, a viral disease transmitted by mosquitoes. It is a single-dose vaccine that provides long-lasting immunity and may be required for entry into certain countries. 4. Meningitis vaccine. This vaccine protects against meningococcal disease, a bacterial infection that can cause meningitis and sepsis. Multiple types of meningitis vaccine are available, and the recommended dosage depends on the specific vaccine being used. Number 4. Potential side effects. Like any medical intervention, travel vaccines can have potential side effects. These side effects are generally mild and temporary, such as soreness at the injection site, low-grade fever, or fatigue. Serious adverse reactions are extremely rare. It's essential to focus any concerns or medical conditions with your healthcare provider before receiving vaccinations. Number 3. Allergic reactions. While rare, allergic reactions to vaccines can occur. It is crucial to inform your healthcare provider about any known allergies or the adverse reactions in previous vaccines or medications. This information will help them determine the appropriate vaccines and take necessary precautions to minimize any potential risks. Number 2. Additional precautions. Vaccines are just one aspect of travel health. It's equally important to practice good hygiene, such as regular hand washing, consuming safe food and water, and using insect repellents to protect against vector-borne diseases like malaria or dengue fever. Being mindful of these precautions will enhance your overall safety while traveling. Number 1. Insurance coverage. Before getting vaccinated, check with your insurance provider to understand the coverage and reimbursement policies for travel vaccines. Some vaccines may not be covered, while others may require pre-authorization or reimbursement procedures. Travel vaccines are a vital component of responsible travel planning. By prioritizing your health and taking the necessary precautions, you can minimize the risk of contracting infectious diseases during your journey. Consult a travel health specialist, ensure you are up to date with routine vaccines, and follow the recommended dosage schedules. Remember to practice good hygiene and take additional precautions as needed. By being proactive and well prepared, you can enjoy your travels to the fullest, knowing that you have taken the necessary steps to protect your well-being. Safe travels! Now, a quick question to you, our dear viewers. Do you like vaccines? Let us know in the comment section below. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top of for more upcoming videos. Thanks for watching.